Good morning. You are watching Issues at Hand on Church of Uganda Family TV. My name is Bruno Edgard. Thank you for joining us. Now, Issues at Hand is proudly brought to you by Potea Hotel Entebbe. And today we are going to have an interesting discussion. The discussion is on the industrial action that's being planned by medical interns, and this is going to have a big effect, especially now during the fight against Ebola virus. What kind of effect will it have, and what is government saying about this issue? It certainly is not the right time for an industrial action, but we want to hear from someone who is part of the medical intern industry, and he will tell us about why they are instituting this industrial action right now. And my guest for today is Mr. Edwin Kigozi. He is an intern nurse, and he is the nurses representative of Uganda Medical Interns United. You are very welcome to Issues at Hand.
Thank you so much, Bruno. I'm blessed to have been invited today at Family TV.
Thank you for the invitation. Now, before we start on why the industrial action has been instituted, tell us a little bit about the Uganda Medical Interns United. What do you do, and what is your mandate?
As you say that, I'm Edwin Kigozi. That is my name. I'm an intern nurse. I graduated from Makerere University. I currently serve the people of Masaka Regional Referral Hospital, and as well exercise my leadership under the Uganda Medical Interns United, an association that was formed to equally represent issues surrounding medical internship. And in this, we represent issues pertaining doctors who are interns. We have dental surgeons, we have nurses, we have midwives, we have pharmacists. Yes. So we equally represent their issues, and most importantly, we unite them for a common goal. Our major objectives surround welfare of medical interns, unity, and also professional transformation.
Oh, wonderful. And for those that might not be aware, because we might take it for granted that everyone knows, but that's not the case, who is an intern and what does an intern do?
Yeah, an intern is a graduate who has been awarded by a respective university. An intern, actually, this is not just a mere intern. We have another narrative of the interns, but here, a medical intern, in this regard, refers to somebody who has graduated from their own institution, that is a university. For example, I graduated from Makerere. I've already been awarded my degree. They are either awarded a bachelor's of medicine and bachelor's of surgery. There they qualify to be intern doctors. Bachelor's of science in nursing, they qualify to be intern nurses. And bachelor's of midwifery, they qualify to be intern midwives. Bachelors of pharmacy, they qualify to be intern pharmacists. And bachelors of dental surgeon, they qualify to be intern doctors. And those are the dental surgeons. So in this regard, we are under training. That's what it is in internship. But this training is mainly focused at giving back to our mother nation, at the same time as a route for licensure. Because if you don't do internship in the medical fraternity is a mandatory requirement. If you don't pursue it, then you don't get a license to serve the people afterwards. Meaning that if you don't do internship, I want to emphasize this, you don't get a license to practice anywhere in Uganda.
Oh, okay. Now that we've understood, according to one of the organizations that that has interns, medical interns, that is, today, the medical intern fraternity and nurses are scheduled to start an industrial actions. Why is that, and how did this come about?
Okay. It is not mere an industrial action. It is a date that we scheduled to have another way to express ourselves as medical interns. I want to bring it to your attention that this has not been abrupt. We had a background. We have different engagements on paper until when we are forced to use this as the only means available. The industrial action, first of all, of course, it is centered on two major reasons. One, we have a reason pertaining salary discrepancies among the medical interns. And two, we have a reason surrounding delayed payments, even amidst this epidemic of Ebola. So we want to tell you that the issue pertaining discrepancies in allowances came from way back 2021, and this has been majorly because of the reluctance, I can call it a reluctance, or being inconsiderate by the Minister of Health to follow the orders from the Fountain of Honor, that is the President of the Republic of Uganda, who issued a directive. And you know, in Uganda, if
that was on the 1st of June this year.
No, the President issued a directive to increase allowances of medical interns on 9th August 2021 in his letter to the Prime Minister of Uganda. And in this letter, it is stated that respective interns should earn half of the pay of their seniors. And in this regard, we had only one document as a reference, that is the collective bargaining agreement of 2018. And in this collective bargaining agreement, it clearly stated that a doctor in the financial year 2022-2023 was entitled to 5 million. That is a senior doctor who is already practicing as a medical officer. Then a nursing officer, a senior nursing officer who has a bachelor's, employed by the government, was supposed to get 4.8 million. A dental surgeon, a pharmacist get the same as the doctor, that is 5 million. And then a nurse, a midwife get 4.8 million. So we were supposed to have that to ensure that the nurses get 2.4 million. And let me tell you that this is just gross, because medical interns are taxed. We shall talk about issues pertaining taxation. However, in this regard, we were surprised beyond reasonable doubt, without any reason. We were surprised to see the Minister of Health implementing this partially. It only favored the doctors, meaning that the dental surgeons and the medical doctors were the only intern doctors who were given a gross pay of 2.5 million. It was painful because the nurses, the midwives, and the pharmacists didn't receive any explanation as to why they received 1.5 million and 2.0 million gross, respectively. So we have been engaging the ministry, and it ended up telling us that, you know, the 135 billion supplementary budget which was released wasn't enough to cater for all of you. We've decided to cater for doctors, but in the next financial year, the next lot of interns shall receive the exact payment they are supposed to receive. And in this regard, we expected, if by the start of our internship, that in April, because I started internship in April 2022, I would be entitled to a gross payment of 2.4 million as a nurse, as a midwife, and a pharmacist will also get their 2.5 million in the same way the doctor gets it. It was quite surprising that during the release of the first payment, we didn't get this. we started engaging as the leaders. We engaged on paper, we engaged verbally, first in the interns induction meeting, which occurred on, we had an induction meeting by the Director General Health Services, who is the overall overseer of the medical internship, that is Dr. Mwebesa. Actually we call Dr. Mwebesa our father, the father of medical interns in Uganda. That is Dr. Mwebesa, who is the Director General Health Services, called us for an induction meeting. And in this interns induction meeting, he clearly stated with the commitment that just give me April, May, and June. July is the beginning of the financial year. I will effect this. We were patient. Until when we realized that this is not going to happen just verbally, we started communicating on paper. We were assured that this will be worked upon, until when we were broken down by his statements that the PS now handles that issue. We started engaging the PS. Since June, July, August, September, until now, we've been engaging the permanent secretary, Dr. Diana Twine, on this matter. And she clearly knows that intern pharmacists have to get 2.5 million gross, and 2 intern nurses have to get 2.4 million. However, there is no valid explanation. There is no formal explanation that has been given to the leaders of the medical internship fraternity as regards to the salary or allowances disparities by the Ministry of Health. They keep communicating on phone. We write to them, they call, they WhatsApp you. Informally communicating. It's not bad to WhatsApp a colleague because we are colleagues, but at a certain point, at a certain time we have to we have to pay tribute to the people who entrusted us. Those are the medical interns we work with, who are unavoidable. But for them, at least they can avoid us. They can go and hide in the ministry when they are inaccessible sometimes. But for us, we work with our colleagues and we need to give them details on paper. So I think the salary discrepancies has been explained enough. Maybe something, even when our seniors our salaries were enhanced this financial year, the medical interns were left at the same line. And we've been patient since then. We haven't had any industrial action. We haven't had any demonstration. Even when the Constitution of the Republic of Uganda provides, we've always resorted to peaceful means because we know what an intensive training we go through, how much we have the little time to complete our internship period. But as the leaders, we are always held at ransom by our colleagues who interested.
On the subject of patients, the spokesperson of the Ministry of Health, Mr. Emmanuel Inaviona, said that you might need more patience is required. And he said there are better ways to air your grievances than go on an industrial action. And the reason why I bring this up is because, again, yes, there's a just cause for medical interns to sort out this salary discrepancy. But if you look at the practicability in terms of government resources right now, we have seen that our government has not been able to fully cater for the budget that was planned for. And in fact, they had to go forward and get a loan, that 1 trillion loan, in terms of ensuring that they can cover the expenditure of the budget. So even that means government does not have enough money right now to cover what has been budgeted for. And So for this issue now to come in, yes, like you've said, a directive was given, but how practicable is it, especially now that we are coming to the end of the year and there are many sectors, education, agriculture, even PDM itself, that have not been catered for. So how feasible do you think government can find that money to honor their pledge to raise the salaries of medical interns?
The reasons you are giving me have not been given to me by any official at the ministry. Okay, if they can air such before you, I think they can air them before me. But they know I can reason them out that they just have priorities. That is why they are able to talk to you directly and they are not able to speak such to me. Secondly, this year, the Honorable Matia Kasaija just released the 158 billion to cater for allowances, including food allowances and all other payments by the medical workers. So why don't they split part of that to cater for medical interns? Secondly, if you look at the way the Ministry of Health operates, it prioritizes a certain group always over the others. I can tell you a medical intern is the person who receives you in these hospitals. But even when Ebola came in, allowances were given to any other health workers, but not medical interns.
So are you saying that when it comes to the Ministry of Health planning, the medical interns are always left out? And why is that? Is it because there might be, and how is it that for the organizations that are there for medical interns, isn't there supposed to be a way of ensuring that your voice is heard, that the medical interns are prioritized?
Okay, as I told you, the Ministry of Health has priorities. That is the best, for lack of words, that is the best reason I can give. Because I don't see any valid reason as to why we should be discriminated. Yet they know our impact in the hospitals. They know how much we serve this nation. The issue of delayed payments, that is issue number 2, backing up this industrial action. I want to let you know that as we begin internship, we sign a contract. We sign a contract of 1 year with the permanent secretary. And in this contract, it is clearly indicated that medical interns shall be paid monthly. Please quote my word, monthly. That is in the what? In the contract we sign. However, the Ministry of Health always gives an excuse that the government cannot pay for a period you have not worked for, because you can withdraw from internship anytime. We entered into a gentleman's agreement with the Ministry of Health under its suggestion that medical interns shall be paid on a quarterly basis, that is after 3 months. But let's come back to reality. Is there any landlord who accepts to be paid after every 3 months? Is there anywhere you can get food and you pay after every 3 months? Because medical interns are not fed in the hospitals. They are not entitled to meals. The Ministry of Health itself accommodates 10% of the medical interns in the country in its housing facilities around hospitals. So sometimes we need transport. And we are people who work 24/7. Meaning that at one point, you need a secure environment. So transportation is unavoidable some days and most of the times. Is there anyone who can give me transport for 3 months and I pay later? Is there anyone who can give me food? Is there anywhere I can rent and the landlord accepts to be given money every 3 months? So we just have to draw back and then come to a mutual understanding with the ministry. These are issues they don't want to listen to, and we've talked throughout about them. They know how much they paid their workers in the hospitals, because the workers who supervise us there when we are pursuing internship are paid monthly. So why not the medical interns who don't even receive food, who don't even get rent, whom you don't even plan for their transport? Even the risk allowances. You talked about Ebola. Let me tell you that medical interns weren't given allowances, not even at Mubende. And we've lost some of our colleagues in this struggle of Ebola. They were not given risk allowances. An intern becomes useful. You always see a tweet about an intern by the Minister of Health. When an intern dies, that is when we become useful before them. That is when you see a condolence message. Why don't they settle these things as early as possible? Person, the Ministry of Health, it's absurd to say that it doesn't even have money. And they always talk about this. They don't have money to provide all the necessary personal protective equipment, basic. And I told you we are the frontliners. We are the first people to receive any patient without even knowing the diagnosis. If the Ministry of Health cannot provide enough personal protective equipment to me as an intern, why doesn't it pay me promptly so that I can prioritize for my safety, buy myself protective gear?
But the government has come out to state adequately, and the Ministry of Health, that in terms of specifically this fight against Ebola, there is enough protective equipment, there are enough PPEs so that both the medical officials, including medical interns, can be safe in the fight against Ebola.
Yeah, the good thing you've said, the government has come out to state clearly. Maybe I don't want to ask you who in particular. Is it the government spokesperson? And who is on the ground? I'm on the ground. I'm telling you there is no PPE. Even if it is the Honorable Minister or the Permanent Secretary, they cannot challenge me about this. There is no PPE. There is nothing to protect me at work. If I tell them that I receive these patients without knowing what they are suffering from, when I'm unprotected, please pay me so that I buy protective gear for myself. If you cannot provide enough, I understand. You get. So they can always tell you anything, but they don't tell such to us. That's why they even fear to communicate to us formally. They rather choose informal means.
But when it comes to the fight against Ebola, isn't this the wrong time for an industrial action? We have a pandemic that we are trying to avoid in this country. Ebola is a very, very deadly disease, and we need all hands on deck when it comes to fighting Ebola virus disease. And we need medical interns for sure. So isn't this the wrong time? Because at the end of that day, think about the patients, think about the lives that may be lost if medical interns down their tools.
Yeah, that is a good question to me, but it is the best question to the ministry. Isn't this the best time to pay medical interns promptly? Isn't this the best time not to delay paying their allowances? Isn't this the best time to solve these salary disparities? Isn't this the best time to provide enough personal protective equipment, acknowledging the fact that medical interns also die? If Ebola strikes me down, I would definitely die, just like you. You get. So we acknowledge the fact that the death rate of Ebola is high. However, we prioritize our safety first, because I'm here to live for generations to save so many lives throughout. I don't mean to say that I don't care about my people because I'm born in Uganda. The only reason I'm doing medical internship is because I badly need to serve people at home. But I cannot serve people at home when I'm in a grave.
So does that mean, okay, what is the plan for the industrial action. Does that mean that does this include medical workers or medical interns that are in places like Mubende, Kasanda, that have been affected the most when it comes to Ebola virus disease?
Actually, in those places like Mubende, at the beginning of this endemic, we tried to advise the ministry that if it cannot provide enough for medical interns, let them be evacuated, and it employs that staff to ensure that it covers the Ebola treatment units other than interns. It didn't listen. We ended up losing lives of medical interns. Quite absurd and painful. So, failure to listen to us sometimes, if we really have to call ourselves leaders, has caused it all. So the Minister of Health should have priorities, but the priorities should be in line with what it is entitled to provide. We should be listened to. We should be handled as people who serve the nation, not as people who are there to serve and go because we are going to remain here. They keep threatening you. The medical internship period is very short. You will go away. Very arrogantly. Let me not go far from arrogant, but the statements are mainly arrogant statements. You cannot tell a fellow leader that your internship period is too short. You will go away. Such statements by the Minister of Health officials, whom we entrust to hold the mother nation.
So what is the plan for the industrial action? What is the roadmap? Are you contacting government? Have you written to government about the industrial action? What is the plan when it comes to ensuring? Because for many of us as the public, whilst we agree and we can sympathize with what medical interns are going through, but there also is a certain sector of people who are thinking about, again, at this time we need to ensure that we chase Ebola out of this country, and definitely we will need the help of medical interns. So what is the way forward when it comes in this industrial action?
The way forward, first of all, this is not an abrupt industrial action. On 20th October, the Uganda Medical Interns United wrote to notify. We had a press release, and we wrote to the Ministry of Health. It got to know that effective 7th November, we shall be laying down tools if the two key issues at hand are not resolved. Let me tell you, we were last paid in August. September, October ended, and if we are now in November, we've not received any coin amidst the hard times. We are not going to start begging from patients. Patients eat onward when you are hungry. Fellow medical workers eat when you are hungry. And we are not going to start extorting patients that you give me 10,000 so that I work on you. Give me this so that I work on you. That is not what we want to resort to. We rather avoid them than causing more harm. Secondly, since they were notified prior and they didn't take it and put it under consideration, we decided to lay down tools.
So they didn't respond to the letter?
They didn't respond to the letter
whatsoever.
They just respond via calls next week, and actually they are very strategic. They don't give you much time. They tell you by the end of this week. They launch towards next week you will receive allowances. This by the end of this week. So by the end of this week and next week are their words. So the next week has not yet come, and by then this week has not yet ended as far as the Ministry of Health is concerned. In this industrial action, we want to let you know that we have something we call skeleton staff, skeleton interns, those who will be providing services at only emergency units. Someone needs emergency attention, medical attention, they will be there to provide. But in the general units, we shall not have them. We've worked hand in hand with the hospital administrators where we were supervised. Our seniors are already aware that what we are, and they fully support us. If someone whose road you are increasing can fully support you, then you have to understand that this is a really serious issue that should be handled immediately.
So for how long is the induction scheduled to continue happening?
So this industrial action has nothing like how long, doesn't answer that question. We've laid down the tools indefinitely, until when the issues at hand are handled. One, we have to ensure that the salary disparities are solved. It is a major issue which has always separated, if not divided us, because the nurses and pharmacists see the doctors as the most useful. Yours were sorted. Why not ours? However, I would like to let you know, with all these engagements, we've come to a conclusion that this shouldn't be looked at as an issue to divide us. It is an issue which is strongly uniting us. That's why we are laying down tools at the same time.
And has there been any government official who has reached out to you in terms of ensuring that you have negotiations? For example, during the strike that people from the medical practitioner were having earlier this year, there was continuous engagement with government officials, as well as the strike by UNATU. There was continuous engagement with government officials. Are you trying to say that government officials right now, especially from the Ministry of Health, are silent when it comes to this matter of the industrial action?
What I can assure you is that they don't have answers yet. Apparently, because nobody has engaged us.
But are you open to dialogue?
We are open to dialogue. And there is no single statement we put up and we don't request for dialogue. Even if they call me now, even if we meet in the studio, we are open to dialogue. That is our mother ministry. I told you we have our chief employer there, that is the permanent secretary, Dr. Diana Atwine, and we have our father, that is Dr. Mwebesa. We are open to dialogue.
Fantastic. Well, the discussion continues here on Issues at Hand, and if you're out there and you have any questions or queries upon this issue, please send us a WhatsApp message on 0787 447 684, 0787 447 684. And for now, things are not so festive in the world of medical interns vis-a-vis the Ministry of Health, because medical interns are saying they are laying down their tools as they are tired of having a salary that is unpaid. It's now 2 months since the salary and the allowances were given, plus there's a salary disbursement as far as the medical interns are concerned, and they are not happy with it, and that's why they have said we are laying down our tools. But this spells doom, especially for the health sector, because we are fighting an endemic called Ebola, and we need the medical interns to be on board. So we're going to find out what the medical interns want government to do so that they can get their tools back in operation. And another issue that is had by the medical interns is the issue of taxing salaries and allowances. We shall find out more about that from our guest today. That's Mr. Kigozi Edwin, who is an intern nurse, and he is the nurses representative of Uganda Medical Interns United. Now, on the issues of taxing salaries, what is the problem? What seems to be the problem? Why is it a big grievance for the medical interns?
Actually, I want to bring up a statement that when we are talking to the ministry, it tells us that we receive allowances. We don't really communicate directly that these allowances should be taxed. Acknowledging the taxation policy in Uganda, that any wage salary above 250 is entitled to taxation. Of course, we are citizens and we should pay taxes.
Definitely.
That is a responsibility of a good citizen.
Definitely.
However, we had a meeting in one of our engagements, and we had to agree that at least for a medical intern, let us take 10% rather than 30%. When they give me 1.5 million, I end up with 1.05. So almost 1 million. You in the public hear about 1.5 and you say that is high, that is enough. But sincerely, they are giving me the right hand and they are taking away the left hand. Secondly, in line with taxation, we don't register TIN numbers. So we don't know who eats our taxes. Who eats this? What if this money just lands in somebody's pockets? We didn't register any TIN number. We don't know where I don't receive any message on my mobile phone that this has been diverted to taxes. Nothing like that. It is just chopped and received like that. Bearing in mind the fact that some hospitals receive more than others. I may receive 1.05, somebody else receives 1.4, someone else receives 1.3. So like that, there is inconsistency, and all that has something it brings. Before me, as a leader, when I try to think through it, of course I don't get any answer as to why these are taxed. I don't get any answer as to where the taxes are going. So that is one about taxation. Yes.
No, definitely. So what do you want? Because now you are involving Uganda Revenue Authority. Because, like you said, any responsible citizen has to do their fair share in terms of ensuring they are providing for the country in terms of taxes. So what would you like the Ministry of Health and Uganda Revenue Authority to do about this issue of taxing allowances?
I don't want anything to be done by Uganda Revenue Authority. Let me not involve those officials. I'm diverting. These people at the ministry know what I deserve, because they are the people who send this money to the hospital. Actually, they don't tell me anywhere that money passes through Uganda Revenue Authority. It goes from finance to Ministry of Health, then to hospitals, and then to my account. They know whatever they have to do to ensure that interns are not receiving with the right hand and the left hand takes away. They know that interns need to get 10%. At least let them contribute 10% of the taxes. Let us be taxed 10%, just. Yes.
All right. So in the midst of all this, remember the discussion we have been having is we have a problem of Ebola on our hands, and we need everyone to be part of this fight. Members of the public, every stakeholder in terms of government, and surely medical interns are at the forefront of that fight. So what is your advice? What would you request government to do in terms of ensuring this industrial action comes to an end so that you can get back to work? What would you like the public to know concerning the plight of medical interns, and what is your advice to medical interns out there?
I'll begin with my advice to the Ministry of Health. I would request the Ministry of Health to, one, honor medical interns as it honors other professions within the health sector. Ensure that it provides to them what they are supposed to receive. We are not demanding for what we are not supposed to receive. They know very well that we are supposed to receive that, and that is why we keep demanding it. Because nobody has ever challenged us, even before them, that we are not entitled to this. Let it provide what we are supposed to receive. by settling salary disparities. Let it give 2.4 million to the nurses and midwives. Let it give the 2.5 million to the pharmacists. Let it tax them at least 10%. Let it provide enough personal protective equipment for our safety. And in any case, if medical interns are requested to work in Ebola treatment units, let it honor us in a way that even a risk allowance that they give to other officials be given to us, because we also risk our lives to treat Ebola patients. That is my call to the ministry. Then to other ministries, like the Ministry of, because we have different ministries, like Ministry of IT and National Guidance. Let Dr. Chris Baliomos, he's a medical doctor, and he knows how much we are affected. Let him come out to resolve these issues. These issues where we have, where we failed to agree. His ministry is there to solve such issues. But it's quite unfortunate that he is also quiet. Let him come out and intervene. Secondly, the Prime Minister. I request that the Prime Minister intervenes and advises these generals at the ministry. And most importantly, let the President also intervene, because he issued a policy through a directive that has not been fully implemented. So that is my advice today to our government in summary. Then my advice to the public: they should remain vigilant. They should know that we are their brothers, we are their sisters, and we are their sons and daughters, we are their grandchildren. It's quite a painful story to narrate that you've lost a person you've invested in millions and millions to come out as a graduate in the health profession to Ebola because of one, lack of personal protective equipment, because they didn't pay them. Actually, most of the medical interns cannot even get money from their families. You a graduate, you can testify before me that when I graduated, I continued receiving the same from my father, because my father knew I wasn't yet a grown up to cater for my needs. If that is the story that way, then we can agree that medical interns can receive money from their parents. Some medical interns even cater for their own families. So if I don't have money to even contribute a single coin to my sister who is in a primary school, then how can I survive Ebola if it approaches me? So let the public understand our position, and most importantly, let it trigger the Ministry of Health to ensure that it provides as expected. Because the Ministry of Health, the only reason as why it talks to you, doesn't talk to me directly, it has to get sympathy from you. I just want to request the public to empathize with the medical interns. We don't even need this sympathy from the public. We need empathy from the public. Empathize with us, and then we can drive this even amidst this Ebola endemic. My other advice to the fellow medical interns, I want to let you know that as the leadership, we are working hand in hand to ensure that your welfare is prioritized. Most importantly, the two issues at hand, we need them to be resolved as early as yesterday, as early as you can never think about, as early as it is called for. We've just been delayed, and we shall overcome this. With your vigilance, don't be intimidated. We've worked hand in hand with any official who supervises us, and the Ministry of Health cannot chase us away, because we need to serve our mother nation. We need to work hand in hand with them as the leaders to ensure that you get what you deserve as the medical interns. Please acknowledge the fact that we receive the same pain you receive. Be vigilant and report anyone who tries to intimidate around. I know intimidations have started somewhere, somehow. However, only look at those who are supportive, and we shall overcome this.
Thank you so much, Mr. Edwin Kigozi, for coming on Issues at Hand and discussing that very issue. And it's our prayer as people, as family members, as members of the public, that this issue is quickly sorted, because and I know we have been speaking a lot about Ebola, but there's so many medical issues out there, malaria and the likes, and so many other, where medical interns are needed when it comes to treating people with illness. So this issue needs to be sorted very quickly, and so we call upon all the relevant stakeholders, government, medical interns, and any other organizations to come together and meet at the table of compromise and of discussion to ensure that medical interns do not down their tools, so that people who need treatment can get their treatment. And we continue to pray for every family out there. In case you have a loved one who is battling with illness, we pray for healing, and we pray for provision for everyone in this country, and for the medical interns as well, that God will provide all our needs according to his riches in glory. God bless you. Thank you for watching Issues at Hand today. We'll return tomorrow. For now, ciao.